earlier in the response, and looking at my Zoom self live next to that picture, I'm like, I look a lot more tired than I did in May or whenever that picture was taken. It was quite the thing. Anyway, thank you for having me. I think that sense of tiredness is certainly one of those symptoms and experiences that most of us can identify with right now, and that's something I'm going to be talking to you about today. I do have, if it's okay with you, I will, unless there's really trouble seeing that, I was planning to keep the slides in presentation mode so I can also see the chat at the same time and keep an eye on things a little bit. I really want to encourage you to ask questions if there's something that you could use more clarification on. And we will have time at the end, as Catherine mentioned, to do a little bit of Q&A. So that's fine too. But I want to make it as interactive as helpful for you all. So that is where we will get started. Okay. Can you see that okay, or do you want me to put it in presentation mode? Is that all right? Is it big enough?
And I think if anyone's having trouble seeing it, you can also just go full screen within Zoom, and that'll also make it bigger.
A little bit better. Okay. So this is the plan. I'm just going to give you some background information and share with you what we've been doing at the Department of Health about forecasting and sort of trying to help get out information about what people are experiencing from a behavioral health perspective in COVID, and then how that looks at work, how it's interfering with our ability to communicate and what's going on a neurological level, and then what we can do about it. Because I am also a clinician, I specialize in my private practice and work with teenagers and adults, so 13 and up. And there's a lot of ways that we can sort of actively work on developing resilience and starting to feel better about some of these experiences. So the first three things on this list here are things that we're trying to avoid, right? So burnout is something that is very, very common right now across all different types of occupations, not just in Washington. And then compassion fatigue is, I would say you could generalize it to any sort of public facing or human facing job. Like if you work with other people, you might have the risk of developing compassion fatigue, which is an inability to experience empathy for someone else's experience. And it's really difficult for those of us who do healthcare work or outreach or those kinds of things, because when you get to a place of compassion fatigue, it's like you can't pour tea out of an empty teapot. There's nothing else to give, and it really doesn't feel good. And then moral injury is something that is a phrase that's typically applied to healthcare workers, like in a hospital setting under crisis standards of care, when there aren't enough beds, there's not enough nurses, there's not enough resources or supplies. It's an experience where you feel compromised because you're not able to provide the care that you would like to be able to provide or that you normally would be able to provide to your customers, your clients, your patients, et cetera. And then resilience and resilience factors are what we're going for. And those are the things I'm going to hopefully give you some concrete ideas for what to do. So this chart is something that we've only updated. Let's see, it was updated 3 weeks ago now to reflect what's going on with the current surge, the current rise in infection rates, and also hospitalizations. It's based off of a graph that came from SAMHSA a long time ago. But the idea with this is that there's a known pattern of response that humans have to any type of disaster. And that's the first thing, is that a pandemic is a natural disaster. It's as such, it's qualified that way. That's how it's important to think of it. And we know how humans respond to disasters because there have been all manner of disasters, and there continues to be throughout time. So whether that's something like 9/11 or a Hurricane Katrina, the earthquake in Haiti, the tsunami in Southeast Asia, the Fukushima meltdown, all of these disasters, and large and small scale as well, we've been studying them for a long time. And we know that there's a certain response that people have to all of those conditions. So a pandemic is no exception. And that's helpful because that gives us a framework to understand why we're experiencing what we're experiencing. So impact phase for Washington was about mid-March 2020. And then the heroic and the honeymoon phases were, it was late April, early May, which, sometimes feels like it was yesterday and sometimes feels like it was 5 years ago, depending on like how it's going. But that's part of what's going on neurologically, is we have less of an ability to track time. We've actually lost some of our ability to track time because there are specific neurons in our brain that code physical locations in space as a way to help us process time, whether that's hours or weeks or days. And because most of us aren't physically changing our environment as much, it has compromised our ability to actually encode the span of time. So if you can't remember what day of the week it is, you're in good company right now. So the heroic and the honeymoon phase was late April, early May. That's when we were all concerned about hoarding toilet paper the first time around. That's to mark that in your head. And then we head down this hill in what's called the disillusionment phase. And this is that's where we are right now. And it's the hardest part of any disaster recovery. It takes about 6 months for the human brain and body to become exhausted and to sort of let the reality sink in about how hard this is. It's not that we didn't know that before, but there's a difference between knowing something is true and actually feeling it and experiencing it. And we are fully in that now. The disillusionment phase is about coming to terms with what is different, what we've lost, the people even that we've lost, and what it means for the future. And it's not a good feeling. We struggle with that. So again, regardless of the type of disaster, the disillusionment phase is the most difficult thing. Unfortunately, given the time frame of when this pandemic hit, the disillusionment phase, at least in Washington and some of the northern latitude states, we also have disillusionment at the same time as daylight savings and the holidays and the weather changing, getting rainy and getting dark. And then we had the election, all the political stuff, and all of those things. We're joking about it and calling it the trauma lasagna at the DOH, like all of these layers of difficulty that we are experiencing. It just so happens to coincide with this disillusionment phase. And we're now seeing what we kind of had anticipated earlier, which is this big increase in rates throughout November and continuing into December. Hospitalizations are on the rise and infections are increasing. So that may result in what we refer to as a disaster cascade, where the whole thing starts over again. There's a second impact. Usually the secondary impact is from something else, like an economic problem or for example, in Washington state, there were many families in our state who were displaced by the wildfires that we had over the summer. So they've already experienced a disaster cascade because they had the initial impact from the pandemic. And then sometime in the summer, they had an issue with the fires. And so they've had a second impact. We worry about the idea of a disaster cascade or a secondary impact on the population at large, because what that does is prolong this recovery. We will still get there. That's the good news, is that we will get back to our sense of normal for behavioral health, like our baseline level of functioning. We will get there, but it might take longer than we want. Realistically, the experience of getting back to normal will be into 2021 for most people, right? Whether that's summer or spring, maybe even fall, but we will get there. Typically for a disaster, it takes about 12 to 18 months for people to return to baseline. With the pandemic, we're expecting it to be 16 to 20 months. We're pushing it out because of the way that the pandemic is influencing our lives and also the potential for this secondary impact. So we suspect that the symptoms that people have will start to get better, and the real experience will be somewhere between the dotted line that you see here and the solid yellow line into 2021. So we don't have a crystal ball, but knowing what we know about disaster science in general and how the pandemic seems to be playing out, that's what we suspect. This is just another, so good question. Roseanne asked, what would be considered our baseline? Your baseline is whatever you were coming into this with. So everybody has a different baseline, and it means the set of symptoms or the experiences or the resiliency skills and factors, the coping skills that you already had before COVID even hit. So everybody's baseline is a little bit different, but the idea is that once you experience a disaster, you recover to your baseline point, whatever that is for you. The 16 to 20 month recovery starts from the impact. So the whole time frame, that's a great question. So impact is when it starts. So all of these numbers on the bottom represent months. So this is 1 year out, 16 months, 18 months, et cetera. And like I said, I think most people's recovery is going to be between these two. It's not as bad as this. That's why we made sure to make it a dotted line. But we don't know how bad the next couple weeks to months is going to be either. So there's some guesswork a little bit in there. The slides I'm happy to share. We share them widely. So I will send them to Catherine or to Khadijah, and we can make that happen for sure. So the other thing that happens, depending on how big this infection rate gets and how much our healthcare system might be compromised in the next couple of weeks, the higher the rate of infections, the more the symptoms are going to be difficult in terms of depression and anxiety primarily. There are no numbers on the y-axis. So the blue wave represents infection and hospitalization rates, and the orange gold color, whatever yellow color that is, represents corresponding behavioral health symptoms. So they pull each other up. So the more infections and the more influence the pandemic has on the population, the more the symptoms are gonna be strong, and they're gonna get strong and get high and stay high for a while. And that's consistent with the graph that I showed you on the previous slide as well. Okay, key takeaways from our forecasting work. We are expecting, and already are seeing, in fact, about 3 million people in our state. I think it's going to be between 3 and 4 million by the time we get through the first quarter of next year, with clinically significant behavioral health symptoms. When I say clinically significant, what I mean by that are symptoms that are strong enough to interfere with your ability to function, whether that's at home with yourself, whether that's childcare, whether that's at work. The symptoms are strong enough that they cause a problem in your ability to function. That's about 40% of our population. There are only I don't even know what it is, 7.8, 7.9 million people in Washington state. So between 3 and 4 million people is about 40%, give or take. So that's a problem because we certainly don't have the professional resources in place to manage that, which is part of the reason why I've been doing these presentations, is to give information out there that helps build resilience so that people's symptoms are likely to be, I guess, helped or supported by having information about what's normal. The more you can share information with people about what's normal right now, the better they're going to feel about it. And that's part of why we're doing this. So the common symptoms are depression and anxiety. PTSD is a big deal for other types of disasters, but not this one necessarily. Now, the exception to that is if you have been hospitalized, or if you've had a family member who was in the hospital or had passed because of COVID, that's an exception. But for most people, it's going to be anxiety and depression. Substance use always increases after every disaster, no matter what type, and COVID is no exception, and Washington is no exception. We're seeing that across the board. We're really concerned about adult women between 30 and 60 with alcohol use right now. Nationally, we're observing and monitoring numbers that are pretty stark in terms of binge drinking for women in that age range. And we don't know, but we suspect that why that's happening is the sense of pressure of juggling and managing school, online education, and work demands, kind of all at the same time. And people are using substances as a coping mechanism. That's not new. A lot of people do that. Most of the time, if it becomes an abuse or a dependence issue, it's going to be not a new thing. It's going to be a problem that people are they're doing things to they're using those coping skills that they already have, and it's getting worse a little bit. Roseanne asked, do these numbers include children? Do you mean the 3 million? Let me think about that. I don't think so. Well, actually, I have to go back and check. I have some notes that I can check on that. When we figured out that number, we were looking at population data for the state, for the whole population. So 7.5 to 7.9 million people in the whole state. And then the way we broke it down are the number of people, I think it's over 18, but I'm not sure, who currently are reporting symptoms and in treatment, or who are reporting symptoms and are not seeking treatment or in treatment right now. And then we added them together. So, and sort of projected out. I have another graph that I can show you, but I think it's 18 and up. So I will double check. Okay. What else? Oh, one more thing I want to mention. The Poison Control Center has been reporting to us that they've been hearing and they've been getting lots of calls for adults over 60 who are having medication errors. They're doubling doses, they're taking the wrong dose, or they're messing something up. We suspect that it's because people over 60 are avoiding going to primary care appointments because they don't want to risk getting sick. So please share with the families that you work with and people that you know. It's really important for people to continue with, even virtually, right, an online primary care checkup, just to get some monitoring and some support around medication management so that people aren't making mistakes. We don't want to risk accidental medication mismanagement or error like that can potentially be harmful. Other takeaways. So violence and aggression usually increase. There's this phenomenon that occurs called acting out and acting in. And it's basically, rather than a bell curve, which is sort of a typical population-based model, we have two lumps of people. We've got acting out and acting in. And it's really common after disasters for most people to gravitate towards one of those two sides. Acting out looks like expressing distress outwardly. So in the summer months, that was aggression, hostility, violence, illegal behavior, substance use, blah, 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 right? Right now, the way that we're seeing acting out is in a form of like active apathy, where people are basically pretending that the pandemic doesn't exist. And I'm like, forget about it. I'm over this. I'm just going to go on with my life, and I'm going to visit my family and friends, and I'm going to business as usual and whatever. So it's still acting out, but it's a different kind of acting out than what we usually see. And then acting in is shutting down entirely, not participating, hopelessness, not, isolating when you don't have to, and not engaging as much the way that you used to. So those are really kind of common things, and that's the same for kids and adults too. The numbers for kids, I'll send out. Yes, I will absolutely send out what I can. There is some sort of breaking information about risks for depression and suicide with youth that are very concerning. We can't give that. I can't send that to you today, but I will pass that along as soon as it's available. We are very concerned about adolescents and youth right now. These folks are not doing well. There's a lot of struggles. So we want to provide a lot of information about suicide prevention, especially for kids under 18 right now. And to teach parents how to ask kids, how not to be afraid to ask about suicide and self-harming behaviors, to help get these kids some support. I think a lot of parents are afraid to ask because they're worried that if you ask about it, it will increase risk, and that's not true. So one of the really helpful things we can do is to sort of help parents understand that by asking about it, it decreases risk. It doesn't increase risk. Okay. Okay, so burnout, compassion fatigue. I mentioned some of these things before. This is what we are seeing consistently across the board. Sleep problems. I'm gonna give you a list in just a second of some really common physical and neurological experiences that people are having, to kind of help normalize it. But all of those things are very common right now. So we will get there. Eventual return to baseline, usually 14 months, or depending on how difficult the next couple months gets, it's just going to take longer, but we'll get there. Humans are incredibly resilient, and that all of the disasters that I've ever, responded to and seen and studied, that is the most common outcome, is resilience. And sometimes just knowing that, okay, as hard as this is, people have the capacity to get through it. That's sometimes a helpful thing to share with families. So this is some interesting data. This is the slide that I wasn't sure. Oh yeah, it says adults, so 18 and up. This is for 18 and up specifically. Makes me think that the numbers then across the population are actually higher than we believe. So what we're looking at here is already, as of November, right, a total in Washington state of a total between anxiety and depression of around 3 million people. So for the purple line, which is anxiety symptoms, this is 1.7 million people. That was the latest data point. We had a gap in data right here and a gap in data right here. So 1.7 for anxiety and about 1.1 for depression. So we're heading towards that 3 million mark. If you notice, so the trend line is generally going up, but this dip, I think, reflects some of the stuff having to do with the holidays and the election. I think that it's not a surprise that it went down a little bit. This is Washington specific data. This is not national data. I don't think that this pattern necessarily would apply to other states, but that's what it looks like for Washington. So we're already, like I mentioned, what is that, 1.1? So that's 2.8 million people with some significant symptoms right now. And these are all adults, just so that it's clear. Okay, good news. Here's how we do this. Resilience can be taught, it can be learned, and it can be developed on purpose. People are born with certain levels of resilience, right? But that doesn't stop people from being able to develop it and learn what it is and work on developing it. So it's not something that you either have or you don't have, and good luck. It's like, okay, now here's the ingredients of it, and here's how we can actually go about developing it. So I'm going to talk about that at the end of the presentation and give you some concrete ideas. Julie asked, do those totals include depression and anxiety? So like comorbid, like both at the same time? It could. Got it. Okay. So this is a census report. So if you are reporting, I do have anxiety and I do have depression. We don't have a separate number that shows how many people are saying yes to both. I think that those are parsed out, so I don't think it's overlapping. But I don't know that. I wish our data team was here to answer some of these good questions. I don't think it's overlapping data. I think it's separate. Yeah. Okay. So here's what's going on neurologically. This is the stuff that I think really helps people feel better because it normalizes. There's two big things. The limbic system is the part of the brain that's responsible for emotional processing. It's also the part of the brain that is responsible for keeping us safe when there's an emergency or a threat. So the limbic system is scanning the environment constantly. It's constantly scanning for where the threat is and then doing something to keep you safe. That's the fight or flight mode, right? What happens at 9 months into a pandemic, or 10 months, or whatever we are, is that the limbic system is exhausted. Your whole brain is exhausted, but it's constantly scanning for threats. And everybody's brain, as a result, right now, is much more likely to perceive neutral information, whether that's a comment from a passerby, whether that's a interaction with a client or a customer or a colleague, or even an email. Your brain is more likely to read that thing or to perceive that thing and say that's a threat, that's hostile or negative, than it is to be neutral, because our brains are trying to keep us safe. So we're hyper tuned into any potential threat, even if it's not so accurate. And the more tired we get, the more inaccurate that becomes, unfortunately. So there's a lot more hostility. There's a lot more tension. There's a lot more likelihood that all of us have right now to snap at other people. You might find yourself sort of snapping back at your partner or at your kids or at a colleague, and then thinking like 10 minutes later, why did I do that? Like, where did that come from? And the sense of emotion dysregulation is really, really strong right now. The other thing that's going on is that the prefrontal cortex is not it's not playing well with the other parts of the brain. It's not as integrated. And what that means is that it's not communicating effectively with what's going on. And how that looks at work is that you can't remember anything, you can't track anything, you can't focus on stuff. It feels like either adult ADHD or dementia because you can't remember anything. Almost every time I do one of these presentations, somebody says, I thought I was getting early onset Alzheimer's disease. Because I think I'm losing my mind. And I'm here to assure you that most people feel that way to some extent right now. The cognitive symptoms are incredibly common. And it's like those things I was just mentioning, not being able to track data, keeping track of details. You can walk into the other room regularly and not remember why you did it, or go to the grocery store and have no idea what you were trying to get on your list unless you write it down. We joke at the Department of Health about having a COVID brain buddy. You need to have somebody to share your brain with, because maybe between the two of you, you can remember everything. It's very hard. Yes, hyper vigilant and more reactive. Most people are right now. Yes, we are. We have a podcast, and this is the 68th presentation of this that I've done. So we're getting it out there to as many people as we can. This is the daily checklist. I call it my daily checklist. I don't know about you all. Easily distracted, quick to anger, frequent, headaches and stomach aches. I didn't mention that. Every disaster clinic that I've ever worked at runs out of Pepcid AC and Tylenol within the first 24 to 48 hours. Everybody coming through the door has a headache or a stomach ache. It's a manifestation of too much cortisol, which is the stress hormone, in our bloodstream. It makes us feel sick. And so that's what that is. Also, trouble falling or staying asleep. So that's one of two things usually. This is either your body is exhausted, but you can't turn the hamster wheel off, spinning, keeping you awake, or you fall asleep no problem and you wake up at 3 o'clock in the morning because your brain is ready to go and you're not. Usually one of those two things. I recommend strongly putting a piece of paper, not a phone. I mean, everybody has their phone right near them, but actually a pad of paper and a pen on your bedside. And if you get woken up in the middle of the night, take whatever woke you up, that idea or that I got to remember to do this or whatever the thoughts are, and put it on a piece of paper, because that will help relieve some of that perceived pressure off of your prefrontal cortex to hang on to it, and just get it on that paper and get it out of your head. The other thing that's happening for most of us is problems with carbohydrates, stress eating, craving carbs. The buttons on your shirt are starting to social distance, getting a tan from the light in your refrigerator. the quarantine 15. I mean, there's so many memes and so many like jokes about this, but it's so real. I think that the Safeway near my house sold out of Ben and Jerry's during election week, like completely sold out. People were stress eating like crazy. And it's normal. And here's why. When you eat carbohydrates, there's a chemical reaction that takes place, and it takes about 3 chemical steps to get to serotonin. And serotonin is the neurotransmitter that makes you feel good. It's like the warm blanket neurotransmitter. It makes people feel safe and comfortable and warm and really good. So we want serotonin, and our body knows that when we eat carbs, it's not a very direct and it's not a very efficient way to get there. But when you eat carbs, eventually you get more serotonin. So that's what's going on. Typically in Washington, everybody snacks on carbs in November and December anyway. The holidays and the winter, the rain and being inside, like that's usually a big deal anyway. But we've been doing it since March. Like this is an ongoing thing. So if you struggle with carbs, you're not alone. And then the other thing is that people are really feeling disconnected. We have all these Zoom things and a lot of virtual meetings, but what's missing is the chit chat, the water cooler discussion, the, hey, how's your kids? How's your family? How's things going? Just what are you doing this weekend? Maybe not much anymore, but just the ability to just chat. All the side conversations that occur with meetings don't have the opportunity to take place in this online setting. Or if it did, it's kind of weird and awkward. So one of the things we're recommending for that is having an open host or rotating host Zoom lunch, where you just eat lunch with people. And that's bad because it's more screen time. Okay, so that's a con, but it's good because it allows you to just chat and catch up with people. And the only rule is that there's no business agenda. Like you can't conduct business, you can't get some stuff done, you just chat. That's the only job. Weighted blankets are a great idea. Yeah, there's all kinds of different options for that. Absolutely. I encourage people to share ideas. I'm not really a fan of the term self-care because it's gotten misused and overused so much. But the idea being is that if you find a plan that works for you for how to take care of yourself, sometimes sharing those ideas with other people gives them ideas too. So you have something that works, it's worth sharing. These are all things that we are familiar with in terms of how this looks. The thing that I will mention on this slide that I haven't mentioned yet is that the thing that prevents us from getting burnt out in our work are the compassion rewards, the moments when somebody has insight. For me, when I'm working with my clients, it's when they make a change in their life, and it's such a good thing. And it takes so much courage, and I get to see that with them. Maybe when you're working with families, it's just when somebody has a success, right? You get to share that part of their experience. Those are the compassion rewards. And that's what keeps us going. It's why we do what we do. And when our brain is in this weird disaster response, recovery, survival mode, the limbic system is scanning for threats. And so one of the consequences of that is that we can't pay attention to, and we can't process and internalize positive information. The limbic system says, oh, you just said thank you for that. Okay, that's not a threat. Boop, bye. I'm going to ignore it. Like water off a duck's back. It does not register as much because it's not threatening or negative. So there's capacity there, right? We have the option to recognize, okay, somebody is saying thank you. Somebody is saying, I appreciate your work, or hey, well done on this assignment, or whatever this work thing was. And our brains don't want to, they don't want to pay attention to that. But if we can and do it on purpose, write it down. Like write down a list of successes. Sometimes people recommend making a list of things you're grateful for, which is good. That's a perfectly good technique. I would also encourage you, with that same pad of paper by the bed and not on the phone, to write down successes. Make a list of things that have gone well, because we're not doing a very good job at that right now. Okay, opportunities for supervisors and managers. And this is not exclusive to supervisors and managers. This is anybody who is in a leadership role or influences other people. Anyone who's a parent is automatically in this role because of social learning and modeling. What's done is what matters, not what people are told to do. If there was no other argument for this than mask wearing, I don't know what it would be. We can talk about it until we're blue in the face, but what people are being shown is what matters. And that's the same thing, not just for that, right? But for boundaries around work. And so this data came out of actually an NGO called Mercy Corps. I don't know how many of you are familiar with their work, But they did a big study to find out why there was so much staff turnover and burnout. And it turns out that the CEO was big on saying, we value employee wellness and we value self-care. And, when you're not on duty, don't answer email. But then the CEO was sending emails at 2:00 in the morning. So this is specifically referring to modeling boundaries around when you're off work, you are off work. If you're on call, you're on call. That's a different thing, right? But whenever you are off, you should have boundaries around not participating in work things, phone calls, emails, whatever that is. I like that idea too. Being honest and open in the communication process. If there's stuff you don't know, because we don't know a lot about how COVID is unfolding, be honest about that, right? That actually came out of data from China and Italy. And then the last one, which I probably don't need to convince you all as much as other groups that I've spoken to, but active listening as a disaster responder and as a clinician, I think active listening is the single most undervalued and important tool in the whole toolbox for how to help people right now, for two reasons. Number one, active listening increases connection, and connection is one of those ingredients of resilience. So that is helpful for the listener and the speaker because it increases the depth of connection. But more importantly than that, in a pandemic or in any disaster, you can't actually solve someone's problems by having a conversation about them. There is no circumstances under which a dialogue is going to solve all the stress that people are experiencing right now with home and with school and with work. You can't do that. So trying to problem solve doesn't feel good to anybody because you don't actually get there. Active listening allows people to work through and process and share their experience. And they might arrive at some conclusions or some solutions on their own, but you're not trying to do that for them. It's listening and having a conversation with someone only and expressly to understand and to care and not to problem solve. It's how do I understand your experience? Tell me more. And if you aren't super familiar with active listening, the easiest way to start with it is to ask open-ended questions. So who, what, where, when, why, how. Not things people can say yes and no to. I'm coming back to resilience. Yes, there's two more slides on it. Just hang on just one sec. So this is a piece of it where I'm going to go into much more depth now. This turns the corner into all these things are hard for us. Now what do we do about it? Part of the presentation. So those are your ingredients up top. Hope, I'm not going to say a lot more about hope than what's on this slide, but hope is really, it's not the same as optimism. I don't like optimism as a clinician. I really like hope. Optimism is a little bit too unicorns and rainbows for me, but hope I really appreciate. Hope is about trying to find opportunity. It's not about being all, shiny about something. It's about what are the realistic opportunities that I have now that I've never had before. And that's not to say you haven't lost things or don't have opportunities, but there are other opportunities that we might not be attending to. So it's about looking for opportunities rather than threats and trying to get our brains to help us with that. Boundaries are super important. Saying no to things, taking time off, not doing work at midnight, or unless your shift is at midnight, right? And then connecting with people on purpose, continuing to engage and participate in stuff. Okay, so two more slides on resilience. Two buckets where resilience comes from: internal strengths and external resources. So for external resources, again, with the list on paper, make a list about what has helped you get through the last 10 months. What are the resources that you have on your side? I'm guessing there are more than you're aware of. And why did it work well? And then what do you still need? Looking at the winter, right? The rest of December and into January and February, what do you need that's going to help you? Write it down on paper. So don't rely on your brain to remember it. And then the internal strengths part. So my favorite of all of those on there, they're all important, but my favorite is self-efficacy. And self-efficacy is defined as your belief in your ability to achieve a goal. You believe in your ability to achieve a goal. Most people have had a really hard time with self-efficacy in 2020 because environmental circumstances have prevented us from meeting a lot of our goals, whether they're personal goals or childcare or work goals or whatever. The disaster itself has in many ways interfered with our ability to achieve a goal. So one of the ways we can get better at that is by focusing on this thing right over here, purpose. Redefining purpose. Now, these are the fundamental ones. Remember, hope is the other ingredient of resilience, but these are sort of the fundamental ones. purpose, connection, flexibility, and adaptability. So what motivates you? Why do you get out of bed? Chances are it's changed. It's not the same thing as it was in January last year. And we need to recognize that. If you have trouble, like I do, about wanting to have a vacation, which hasn't happened at all this year, try to think about how you can have success and what you can do and what you can look forward to that's right now. That's like, what do I need to get done today? What can I do this weekend that's fun? And keep it, I mean, really keep it on a 2 to 3 day kind of limit, which is really hard for us. We're not used to that, but it's really helpful for this piece of resilience. Think short term, think small picture, not big, and redefine it, basically. Look at just the next couple days. Connection can be anything. It can be any relationship or any engagement that's bigger than you. It can be to God or to a higher power. It can be to a family member or a loved one or a friend. It can be to a social cause that you care passionately about. It can be to pets. Pets are great connection for people. Anything that stops us from being isolated. And then the last one there is flexibility and adaptability. And that is the hardest one. People in general don't like change. We don't do very well with change. A lot of the folks that I work with clinically would rather stay in an unhealthy zone that they're familiar with than move to a new zone because it's unfamiliar. And that's really hard. When I'm teaching this internationally, I use the metaphor of a tree. So the purpose of the tree is the fruit that it produces. The connection of the tree are the roots that ground it and give it nutrients and care. And then the flexibility is the ability of the tree itself to sway in the storm. Because if it's rigid and if it doesn't adapt, it will fall over. And for humans and businesses and organizations and teams, we have to adapt in a disaster. And it's challenging for sure. But there are options there too. So being creative is a challenge when our prefrontal cortex is not working the way that it should, but maybe that's something to work on with somebody too and not have to do it alone. Okay, just two more. Last model here for you. This is an acronym that I developed to help people avoid compassion fatigue. Reward yourself for a job well done. Positive reinforcement is the single easiest and most effective way to change human behavior, period. We have so much data on that, it's not even funny. And that goes for yourself, that goes for your kids, that goes for your colleagues, it goes for your partner. Positively reward people. Gold star. It was probably 3 weeks ago now, I did one of these presentations and somebody said that when she has a business meeting that she doesn't want to do, she has a box of Frangos on her desk and she'll give herself a Frango when she finishes the meeting that she doesn't want to do, which is great as long as it doesn't turn into the whole box of Frangos, right? One Frango is one thing, a whole box of Frangos, not so much. Or also a glass of wine, not a bottle of wine, right? The rewards they're great, but they need to stay healthy because if they become alcohol or substance or carbohydrate related, it can get a little uncomfortable. So be careful with that, but that's really a helpful thing, whether it's a gold star chart or a little treat of some kind. And then boundaries, I've said a lot about that. It's really important for people to have good boundaries around work and especially to not be available at certain times. And then to share your concerns, share your thoughts, share your experiences, continue to engage with people even when it's hard. One very concrete example of this is that if you have a nasty or a difficult or a confrontational sort of encounter with another human being, do not keep that to yourself. That is something that needs to be shared with other people. And it's not our instinct necessarily to share it. I mean, I'm not talking about like on Facebook, right? I'm talking about sharing it, like talk to somebody else about it, continue to participate. And then trust the network, ask for help, say no to things when you have to. If everybody starts doing that, imagine how much more efficient we'll be in the long run, right? Culturally, we don't do this. There's this myth of indispensability where I have to be the one. And that comes from all kinds of different things, right? But if we all helped each other, we would be able to accomplish a whole lot more. And so that's about asking for help when you need it, but it's also about helping other people by picking up some slack when you happen to have a little bit more energy that day. Okay, last thing. This is about working smarter and not harder. Nothing I'm talking about today is about adding more to your plate, like do more. No, absolutely. In fact, the opposite of that. We have to shift our expectations around success. We have to adjust our sense of what performance success looks like and cut some slack across all of the things that we're involved in. And for kids as well, right? School achievement is not the same this year, and we got to let go of some of those things. I think that teaching parents and working with families to model and learn emotion regulation in the disaster is way more valuable than whatever the new math is supposed to be. That's just as an example. Like if that's something that we can do and come out of this with, that's a win, because it's a tough thing. So it's about this domino effect of when we start taking care of ourselves individually, people see that, we model that for them, they copy it, and it becomes a culture shift over time. Get outside, bundle up. Outside is good. It's good neurologically. It's good in so many ways for people too. So that's it. These last two slides are just resources. So there is a family toolbox that I would highly recommend for your organization. You can find all of our resources on the website that I'll put into the chat, but this family toolbox is like a 50-page document that explains what the red flag issues are for kids right now, what's normal, how to handle it. Like it gives concrete tips for parents from all the way from K through 12, and young adults too. And then the resilience guide is a good one. I know I'm biased, but I will put those in the chat. And yeah, if there are any questions, I'm happy to take them.
Kira, there was a question earlier about different language availability for these resources.
We are putting this in Spanish right now. We don't have it. It's being, it's continuously being, as we do content updates, it gets updated for accessibility. But we are getting it in Spanish right now. I don't know what the time frame is on that because that's not my department. But the communications folks are working on that. We have other training that we offer as well that's in a variety of different languages. It's called Health Support Team. It's referenced right here. If you send an email to, if you're interested in signing up for that training, let me, I'm going to put the email in the chat so you can email. Hang on. So if you want to participate in the Health Support Team training, which is, it's a 3-hour training, but it trains anyone who's interested with no background in professional psychological support to provide psychosocial support for friends, families, and communities. So if you're interested in that, let me know. The podcast. Oh, yes. Sorry. Thank you. I'm just getting caught up with that. Elizabeth asked what, I am glad you have the link because I don't even know where the link is. And it's a podcast that I'm participating in, but I don't even know where to find it. So thank you. I should actually copy that link. I might do that.
Maybe we can add that link too to the resources slide when we send them out to everyone too, so people
Good
have
idea.
it accessible.
Yes, I will do it right now. Move this picture down. Boop. I will forget because that's my COVID brain at work. I will not remember. Yeah. So any other questions before I wrap up? I'm doing the podcast with another one of the members of the behavioral health strike team. He's a child psychiatrist named Dr. DeSherry. He's really nice to work with.
So I think this
right now. Yeah, sorry.
Yeah, I was going to say, I think this is also a question for us. We'll send it out. I think probably today, I assume we can do, we'll send it to everyone. We have a list of email addresses who registered through Zoom. So we'll send it out that way. We'll also send it out for those of you who are HVSA funded in those communications. And for those of you who are funded from Best Arts for Kids, we'll send it to Adrian and Melanie for them to send out to. So we'll send it out in a bunch of different places, hopefully today or tomorrow. And Kira, I think this is for you if we can share externally the recording.
Absolutely. There's actually a YouTube one. I did it for the Department of Transportation, and they posted it on YouTube. I didn't know they were going to do that, but it's on there. So yeah, it's been shared. It's been shared widely. I don't mind what you do with it. I just get, every time I'm more tired, which is normal for 10 months into this.
I just so appreciate what you said, though, about getting this out there. I mean, I think this is important for the families that we're working with. It's important for us, but like, I'm just thinking of even friends that you know, the normalizing nature of this and the normalization of what's happening with our brains right now is
Yeah.
so important. So I appreciate that you're getting out
Yeah.
there widely.
Yeah. My friends too, like I was just having a group text and like, I think I'm losing it. Like, I can't remember anything. I'm like, nope, you're fine. It's normal. So yeah, happy to share with you all. You can always reach me on email too, Catherine. So if there are follow-up questions or things that come up after the fact, please don't hesitate to reach out. Our team isn't going anywhere. We will be working on all of this recovery process well into next year. So I will be available for a while. Yeah. You all do really hard work. You do incredibly difficult and really valuable work. So I'm impressed and I'm encouraged by you know, hearing about some of the things that you're up to. And I don't know. I just encourage you to keep going because we'll get through it.
Kira, can I ask you a question, which is
Sure.
right now in particular, as we're heading into the holiday season, knowing that the holidays, even in regular years, can be challenging for a variety of reasons.
Yeah.
So I'm curious if you have any sort of thoughts in particular about the holiday seasons, both as a way to sort of find joy, but also knowing that it can be challenging in other ways too.
Yeah, I mean, the biggest challenge is the creativity part, and what we are encouraging people to do is to replicate the experience of the holidays without replicating the conditions. So identify, like it again. I know pen to paper. I say that a lot, but write down like what is it about the holidays that you like? Like, is it the family time? Is it the humor? Is it just eating a bunch of stuff and sitting around? Is it watching football? I mean, I don't even know, but like make a little bit of a list of your favorite things about the holidays, and then it's about creatively kind of trying to find ways to replicate those experiences, even if you can't physically be in the same environment. So if it's family time, like we had Thanksgiving on Zoom with my um, parents-in-law and brother-in-law and his family, and it was weird because it's just weird. But we just put the computer up at the end of our table and we had Thanksgiving together, even though we physically weren't in the same room. So it's, there's pros and cons, but there are also ways to sort of meet some of those needs and those expectations in a safe way. And also keep in the back of your mind this whole time that it's not permanent. Like this is just something we have to do right now, but it's not going to stay this way. And no disaster ever stays that way. There's things that change and might not change back, right? But that's not one of them. We're not going to lose the holidays forever. So it's good to keep that in mind too. Videos are shorter resources for parents with youth, 50 there is an index for the child, the toolkit. So it's meant to be modular. There's pieces that you can pull out of it. And then there's an appendix at the end that has models in Spanish and in English that are more acronyms. I'm sorry, I can't help myself. One of them is called Strong Kids, and it gives parents very succinct, concrete things they can do to help support kids. So yeah, there's even though that's a big document, you can take pieces out of it. It's not meant to be all at once. Yeah, I know. I know it is harder to be creative. Maybe that's you could do it with a group of people, right? If you don't have to have all that pressure on yourself to come up with creative ideas, if you sit down with 2 or 3 people, come up with some things. One of the things that I'm doing with another group of friends is having a Secret Santa ornament exchange. So we we pick out an ornament or we make one and mail it to them. And then we do a Zoom where we all open it at the same time and try and guess who sent it to us. So I mean, I've never done that before. We'll see, see how that goes.
Well, I want to thank you so much for being here. We so appreciate this information. And then I also want to echo what you said and thank all of the people on this call who are doing such important work with families. And we just can't overstate that enough and the importance of your work, but also want to really encourage you to take care of yourselves, especially right now, because you're really important. As I said, we will be sending out the recording, all of the slides, and including those resources. If you have any questions, maybe Khadijah, you can put the email address in the chat if people want to reach out to us and we can connect them to Dr. Mauseth. I think that's everything. So thank you all for joining. and have a good holiday season to the best of abilities, and a happy new year. And we'll talk to you in 2021. Thank you all.
Thanks for having me. Bye-bye.